Way to the front. The front's that's crazy. Look at the way you reflect light.
Gosh.
Recap for everyone who wasn't here a few months ago, or 3 months and a week or so, week and a half out. And this was on the Cupid Compendium. So this was all filmed, which means none of this could be later said, okay, it's coincidental we got those improvements. Every little tiny improvement was deliberate and predicted. So you can see here, little lip area looks brighter, mouth looks brighter. The eyes,
That's significant.
you can see here how it's indented.
Yeah.
Now it's not. And the chin, look how it reflects light.
I mean, it's incredible.
And the necklines, you see those?
The neckline, yeah. As you said, it's made my face more feminine, but also it's just alive. I look alive. I'm glowing. You know, I look in the mirror and I feel like how I feel on the inside. Now I look like it on the outside.
Yeah, we ignore this. We just look like that.
Yeah, completely.
Bright and healthy. And even look at the lip. You won't even know what happened to the lip there, except for it looks softer, healthier, a little sexier.
And it's full.
Look at the chin.
It's
how lax it looks over here, and how here it just looks tight.
Beautiful.
Smooth, not an indent in this.
No.
It was AuraLyft, fat grafting, brow, which is not really a brow lift. It's a temporal kind of scalp reset. Upper blepharoplasty, like barely touching it. Lower blepharoplasty, which included fat repositioning and a retractor release. And ptosis repair. And the ptosis repair was a MMCR, meaning it was a conjunctival muleirectomy. 7 millimeters, which gave her 2 millimeters of opening, which is why, when we go back to the photos, you can actually see the light reflex on the eye, whereas beforehand, you can't see any light reflex on the eye. You can see how much it brightened it up, even though I didn't open your eyes up that much.
No.
And you can see how your brows, infrabrow, all the way across,
Yeah.
no longer deflated. And even look how much brighter light reflects from the eyebrow itself.
Everything.
Because it doesn't do this. It has a nice round surface that light can bounce off of.
It's incredible. And the texture of my skin.
Yeah.
It just feels healthy and full and just,
Easy and
wow.
Now with this, I did my new suture technique. You didn't really have many jowls, but I've been doing this suture technique where I make sure I rotate the front of the face more.
Okay.
The cool thing is with these massive neck improvements, so all of these, and this is for the people at home, there was 0 dissection of skin done in the neck. 0 in this part of the neck, only lateral to the jawline. This is what we call limited delamination technique. Some people call it preservational. I call it limited delamination. Doesn't matter what you call it. But this neck improvement is massive, but 0 work on the neck, which is why it's going to age better. You didn't lose any fat. You didn't even have to heal in that area.
No.
I ended up putting fat into the line, so I actually added fat into the neck, so the neck is going to age better. Surgery generally makes it age a little worse for skin quality. That's why your skin quality there looks amazing.
Incredible.
So people wonder where wrinkles come from. Wrinkles come first from deflation. Pores, you see the pores?
Yeah.
You see those pores, everybody? Big, big pores on the front of the face beforehand. Don't be embarrassed. All right. And then afterwards, you don't see them anymore. Not because the pores are gone, not because the pores were enlarged. It's because they had deflation. Everyone's always worried, is my eyelid shape going to change?
No. It's just going to look incredible. I mean, and that's the thing I think people say they worry about. And when I was telling people I was going to go through this, they're like, yeah, but you might not look like yourself. And you're the only person I trust to do this. And you have taken me. Someone sent me a photo of me when I was 18 and my eyes have the same light and energy. I'm so grateful and so thankful. And we are very lucky to have you because the process for me was beautiful. It was done with care. I trusted you. You were very kind. You invested in my face. You know, you invested in my story, and that just means the world. I've had a hard few years and you've just completely just taken them away from me. So good. Thank you.
Well, and lesson learned for everybody. Let me do whatever I want.
Yes.
Okay.
Just trust him.
Don't limit me. People always say, do you need to do the fat grafting? I'm like, no, but do you need to look the best you can? Because they always worry I'm going to do something that's going to make them look fake. When it's obviously not my goal. So let me do whatever I want, because if you let me do whatever I want, I'll fix more. And that's all it is. It's like, imagine stuff's broken all over your house. You know, someone comes in, offers you, I'm going to go fix everything. And you say, no, 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 leave the dishwasher broken. Leave the laundry machine broken. Garage door, I love that it only opens halfway and falls on my car sometimes. Only paint that one wall, even though you're going to come into my house anyways. That's the lesson here, is let me do whatever I want. The surgeons who are perfectionists, I'm a perfectionist, I'm an artist, whatever they are, watch me in the operating room. And they're like, holy shit, Ben, you're on a whole nother level of neurosis. And it's not me wasting time and just being nervous or anything like that at all. There's no nervousness in it at all. It's just I see everything and I want to get after everything and I don't miss anything. I would hate if I missed anything. So yeah, for people who are nervous about outcomes, I'm way more nervous about outcomes, way more cautious about outcomes than any patient would ever be about their own face.
Yeah.